Hello, I'm Dr. Rick Chatwell, board-certified rheumatologist at the Arthritis Center of Nebraska. One of my interests is in osteoarthritis. Osteoarthritis is an arthritis affecting more than 20 million Americans and is one of the leading causes of disability and pain. I'm pleased to have you join me as we discuss understanding osteoarthritis. Osteoarthritis is the most common joint disease affecting middle-aged and older people worldwide. It is characterized by progressive damage to the joint cartilage, which is the slippery material at the end of bones, and also leads to mechanical changes in and around the joint. These changes can lead to pain, stiffness, swelling, weakness, and limitations to daily function. Osteoarthritis can affect any joint, but most commonly the weight-bearing joints of the knees, hips, and spine. Osteoarthritis in the knee and hip joints can generate chronic pain or discomfort during standing and walking. Deterioration of discs between the spinal vertebrae can cause back and neck stiffness and pain. Osteoarthritis also can affect the fingers and any joints with previous injury from trauma, infection, or inflammation. Some patients may develop bony knobs or nodes that enlarge the finger joints, causing pain, stiffness, and later restricted use of the fingers. Most people with osteoarthritis describe the onset of their pain as gradual and experience joint pain during activity which can be relieved by rest. Most people also experience morning stiffness of the involved joints, often less than 30 minutes in duration. Articular gelling, or stiffness after a period of rest or inactivity, is common with osteoarthritis and resolves within several minutes of renewed physical activity. Most osteoarthritis patients experience worsening symptoms with changes in the weather. Characteristically, their symptoms are worse in damp, cool, and rainy weather. Changes in barometric pressure may also create discomfort. Those with latter stage osteoarthritis may suffer more severe pain and unstable joints, causing a sensation in the knees of giving way or locking. Pain at rest may mean that the disease is worsening. Osteoarthritis arises from problems with the cartilage that cushions the ends of bones. The slippery material serves as a shock absorber, if you will, providing a smooth gliding surface for joint motion which reduces friction in the joints as the body moves. When the cartilage is damaged or worn, tendons and ligaments can stretch painfully, or worse, bones can come into contact. Joint damage leads to malalignment of the joint surface, which can further compound joint damage. There are several phases in osteoarthritis. First, the cartilage loses elasticity and is more easily damaged by injury and excessive use. These changes may be influenced by age, heredity, and trauma. Second, as the cartilage breaks down, changes occur in the underlying bone, including bone spurs and bone cysts. Thirdly, small pieces of bone and cartilage become displaced and float loosely in the joint space. Finally, the joint capsule lining or synovium becomes inflamed because of the cartilage breakdown. Along with this inflammation, inflammatory proteins, called cytokines, and other enzymes are produced that may further damage the cartilage. This inflammation may decrease the quality of the synovial fluid, which then reduces its protective function. Although the cause of osteoarthritis is not known, risk factors include heredity, obesity, joint injury, repeated overuse of the joints, muscle weakness, nerve injury, and age. Age in and of itself is not a definitive cause of osteoarthritis, but can worsen the deterioration process. To help prevent osteoarthritis, it is important to maintain muscle strength and a healthy weight. Osteoarthritis strikes people at different ages, but is more common in older populations. 2/3 of people over the age of 65 have X-ray evidence of osteoarthritis of the knees. However, only half ever develop symptoms. Women are affected more often than men, especially with osteoarthritis of the fingers and the knees. The diagnosis of osteoarthritis can be made by clinical history, physical examination, and confirmed by plain X-rays. Additionally, routine laboratory tests are helpful in screening for associated conditions or establishing a baseline for monitoring therapy. Osteoarthritis is suspected when patients have pain in the commonly involved joints. Bony enlargement is common, and limitation to range of motion increases with arthritis severity. Malalignment of the joint, crepitus, which is a gravelly noise on joint motion, joint warmth, and joint swelling may also occur. Since osteoarthritis is so common, it may be present simultaneously with other types of arthritis. There are more than 100 diseases that cause arthritis and other potentially disabling disorders of the joints, muscles, and bones. Appropriate therapy requires an accurate diagnosis. Because of the variable nature of this serious disease, the treatment of osteoarthritis must be individualized. Selecting the best treatment requires a mutual effort by both the patient and the physician. The underlying principles of managing osteoarthritis include relieving symptoms, maintaining or improving function, limiting physical disability, and avoiding drug toxicity. A good treatment program includes patient education, physical and/or occupational therapy, exercise, weight control, and medication. Physical measures such as exercise, support devices, and heat and cold therapies are usually effective. Some forms of alternative therapy, such as massage, acupuncture, and chiropractic manipulation, can help relieve pain for a short duration, but these modalities are usually costly and require repeated treatments. There are many available forms of drug therapy for the treatment of osteoarthritis. Topical agents such as capsaicin cream work by reducing substance P, a neurochemical transmitter that sends pain signals to the brain. Aspirin or salicylate-based creams work by stimulating blood flow. Skin irritant creams stimulate nerve endings in the skin to cause feelings of cold or warmth, which distract from the actual pain. Oral pain relievers, such as acetaminophen or Tylenol, do not reduce the inflammation or swelling sometimes associated with osteoarthritis, but when used appropriately, they are helpful in relieving pain when pain is the main problem. For most people, acetaminophen is a safer alternative than the use of non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, or NSAIDs, help reduce joint pain, swelling, and inflammation. Over-the-counter NSAID examples include aspirin, ibuprofen, naproxen sodium, and ketoprofen. Whether using a prescription or over-the-counter non-steroidal anti-inflammatory drug, these medications are not without significant potential side effects. To ensure safety and to avoid drug interaction, consult your doctor before using any of these drugs, especially in combination with any prescription medications. For more serious pain, stronger medications such as narcotics may be occasionally considered for the treatment of moderate to severe pain. Long-term use can cause dependency and tolerance. This can lead to the need for increased medication dosages over time in order to maintain benefit. Joint injections with synthetic corticosteroids are related to cortisone, a natural body hormone, and are commonly used in the treatment of osteoarthritis. Corticosteroid injections in the same joint are usually limited to 3 to 4 injections a year. Hyaluronic acid therapy, a form of lubricant found naturally in joint fluid and in cartilage, has proven effective for some patients. In people with knee osteoarthritis, inflammation causes hyaluronan to break down and become defective. Hyaluronan injections are given directly into the joint once a week for 3 to 5 weeks, depending on which product is used. Surgical options such as arthroscopy or joint replacement are considered when the joint is seriously damaged, the patient is in intractable pain, or is experiencing a significant loss of function. Many nutritional supplements have been used in the treatment of osteoarthritis, but most lack good research data to support their effectiveness and safety. Recent studies have shown that patients with moderate to severe pain from knee osteoarthritis might benefit from chondroitin and glucosamine sulfate supplementation. Again, to ensure safety and to avoid drug interaction, consult your doctor before using any of these agents. There is no cure for osteoarthritis, but you can help manage how it impacts your lifestyle. For instance, giving proper positioning and support to the neck and back during sitting or sleeping, adjusting furniture such as raising a chair or toilet seat, and avoiding trauma and repetitive motions of the joint, especially frequent bending, are excellent starts. Adding regular exercise to your daily activities will improve muscle strength. Exercises that increase the strength of the quadriceps muscles, or thigh muscles, can help prevent knee osteoarthritis. Working with a physical or occupational therapist can help you learn the best exercises and assistive devices, such as a cane, for your joints. Weight loss in overweight people can reduce the pain and progression of osteoarthritis. Achieving and keeping an ideal weight will make a substantial difference in comfort levels. Osteoarthritis is characterized by a gradual loss of cartilage from the joints and, in some people, joint inflammation. Osteoarthritis can affect almost any joint, although it occurs most frequently in the hands, knees, hips, and spine. Common symptoms include pain, stiffness, and decreases in joint mobility. Changes in the appearance of affected joints can occur and may be bothersome. Osteoarthritis is a chronic condition that gradually worsens over time. However, treatment can often reduce the symptoms, sustain a person's level of physical activity, and possibly slow the progression of this condition. The treatment of osteoarthritis is tailored to many individual factors, including the severity of the condition, the specific joints affected by the arthritis, and the effectiveness of any given treatment. It is important to work with a rheumatologist to create an effective and acceptable long-term plan for living with osteoarthritis. Thank you for your interest in learning more about osteoarthritis. Our team of Mayo Clinic trained and board certified rheumatologists at the Arthritis Center of Nebraska consider it a privilege to help people with arthritis and autoimmune diseases. We invite you to call 402-420-1212 for more information or to schedule an appointment. Thank you.